Welcome to the fourth instalment of the University of Queensland Faculty of Health and Behavioural Sciences Alumni Webinar Series. My name is Paul Purcell and today we'll be joined by Dr Karan Gulati from the UQ School of Dentistry. Dr Gulati's main research focus is surface modification of dental implants to achieve long-term success, especially in compromised patient conditions. He has worked in this space for more than 10 years and is currently a part of Professor Sasha Ivanovsky's research group at UQ. I begin today by acknowledging the traditional owners and their custodianship of the various different lands on which we're all meeting today. On behalf of the university, I pay our respects to their ancestors and their descendants who continue cultural and spiritual connections to country. We recognise their valuable contributions to Australian and global society. For those of you joining us live today, please feel free to ask questions as we go via the Q&A function within Zoom. We'll endeavour to get to these prior to the conclusion. This webinar is also being recorded and will become accessible via the HaBS Alumni webpage, along with the other episodes in the series. This will be sent out to you in an email once the recording is live. And now, it gives me great pleasure to introduce Dr. Karan Gulati.
Thanks, Paul, for your introduction, and good afternoon, everyone. And thanks for joining the webinar series organized by HaBS. So today I'll be talking about fit and forget nano-engineered dental implants. My name is Karan Gulati. I am an NHMRC Early Career Fellow at the School of Dentistry, UQ, at Hurston campus. I belong to the group by Professor Sasha Ivanovsky, I-team, which is Tissue Engineering and Additive Manufacturing team. And today I'll be talking about how we can improve the long-term success of dental implants, especially in compromised patient conditions. So just a brief overview of what dental implants is, because we have a wider audience here. So when a tooth is diseased, damaged, or lost, we need to replace it with what is called a dental implant. It involves removing the diseased tooth and drilling a hole via surgery and inserting in a screw. You put the screw in, and then the other component that goes on top of it is the abutment. So the screw interacts with the bone tissue, and the abutment interacts with the soft tissue, the gum tissue, and on top of that you put the crown. So this is the complete setup of a dental implant. Although dental implant success rate is quite high, especially in healthy conditions, however, 5 to 10% of the implants will fail, especially considering the ongoing conditions. And these include poor oral hygiene, smoking, diabetic patients, aged patients, osteoporosis, and ongoing conditions. Just to give you an idea, where a healthy implantation procedure will cost around $6,000 to $8,000, it will be considerably more for conditions that I just mentioned now. Now, when there is an implant failure, you have to double the amount. So it is a lot of cost involved in correcting a failed implant and then performing another surgery to have another implant inserted. So 5 to 10% is the rate of implant failure. Furthermore, for heavy smokers, it can be up to 20%. So dental implantation and its failures and the related therapeutic needs to correct or make sure the implant is surviving for long term, it's a national challenge, both health and economic wise. So whenever you put a foreign body, in this case, an implant inside the body, there is always a race to invade. Now, the race to invade is the race to reach the site and adhere onto it and basically colonize it. So there is a competition between the healthy cells and the not so good cells like bacteria. So let's talk about the components of the dental implant. The abutment is the component which interacts with the soft tissue. And then there is the implant screw, the fixature, which interacts with the bone tissue. So the good cells, the cellular activity we want to enhance is the bone cells and the soft tissue cells, whereas the bacteria, which is always present in the oral microenvironment, is the biggest threat. If the integration is not proper or established earlier and maintained in the long term, the bacteria will get access to inside the implant, and that is very detrimental towards the success of the dental implant. So we need a modified implant whereby we can play around with this race. We want more integration, whereas no infection. How do we do that? We call it nano-engineering. So we have an implant screw and we perform a procedure called electrochemical anodization. And what it does is it basically fabricates nanopores all over the surface of the implant. Nanopores are like tiny test tubes, open at top and closed at bottom. And because they're nano-rough in nature, they can be used to improve the functions of the cells. Now here I mean bone cells and soft tissue cells, such that the implant is integrating well, the bonding between the implant and the tissue. And because they are empty, they can be used to load drugs, protein growth factors, or antibiotics, which will be released locally once the implant is placed inside. So this is the technique I've been working on since last 10 years. And this is what we have recently optimized, focused on dental implants here at UQ. Now, what is electrochemical anodization? I won't go too much into the electrochemistry part of it, but briefly, it involves an implant and a counter electrode, which is immersed in an organic electrolyte with presence of fluoride ions and water. So basically, fluoride ions and water are the driving ingredients. And then when you complete the circuit, you supply voltage, which is anywhere around 20 volts to 120 volts. What you get is formation of these nanostructures. And the nanostructures will form all over the surface area of the implant. Here we have two different kinds of nanostructures. One is nanopores and one are nanotubes. Nanotubes are more cylindrical and there's a gap between the individual nanotubes or tubes. When they're fused together, we call them nanopores. Interestingly, nanotubes is the most researched structure when it comes to electrochemical anodization, but nanopores, which we have recently optimized, is way more mechanically stable. We can control the diameter and length of these nanostructures. And this is a typical scanning electron microscopy, SEM image, showing they are open at top and closed at bottom, just like test tubes. So now I'll show you some of the results that we have been working on in the past couple of years, focused on dental implants. So nanotubes have been fabricated on different structures for many, many years. However, more recently, we fabricated mechanically stable structures, which included pores, which can be aligned on random. It can also include nanotemplate, which is formed when you remove the layer of the nanopores. The reason we are talking about nanopores is because when you put a dental implant, so it involves multiple mechanical stability issues, because the implant has to be handled, it has to be packaged, it has to be delivered, it has to be screwed in, and then it has to survive the constant chewing action. So the structures we have fabricated are way more mechanically stable because we want it to survive inside the dental environment. Fabricating on easy to manage surfaces is one thing, but we took it to another level because we are focused on clinical translation here at the School of Dentistry. So more recently, we optimize the fabrication of complex nanostructures on dental implant components, which is abutment, the soft tissue component, screw, the bone component. We can fabricate aligned nanopores, where the nanopores are aligned in the direction of the underlying micro-roughness. We have nanotemplate, where you peel off the layer and you have basically imprint of the nanopores. The random nanopores can also be formed. Now, the reason why we need aligned on random nanopores is because based on the alignment, we can control how the cells behave. The technique that we use has been optimized over the years and we still continue to optimize it. And it is pretty much scalable and it is cost effective. With just $1,000, we can literally start fabricating and modifying a good number of implants because the setup literally cost $1,000. So it is very cost effective. It is scalable and we get good control over the dimensions of the nanotubes. Now remember, because these are test tube-like structures, if you control the dimensions, you can control how much the drug goes in and how much is released. And because I told you, they are optimized, they are super mechanically stable because we want them to survive once they are placed inside the dental microenvironment. align nanopores. So what we did was, in dentistry, micro-roughness is regarded as a gold standard. Most of the dental implants will have some sort of roughness on top of it. However, to fabricate nanostructures, generally research involves polishing the surface. But we have shown that we can preserve the micro-roughness of the implants and superimpose nanotopography. Now the structures that you see here, TNP is titanium nanopores at 40 volts, 60 volt and 80 volts. And they are aligned in the pattern as shown by the micro titanium. So micro titanium is basically micro machined. It is machined in one direction. So it is having micro scale roughness in this direction. And when you fabricate nanopores, you preserve the micro roughness and then you superimpose on top of it nanopores. The nanopores get aligned in the direction of the micro machining lines. So this is dual micro and nanostructures, which has been reported for the first time, especially for use in dental applications. We get a control over the topography and the chemistry of it, because we know both of these things, the chemistry and the topography is what influences the cell functions. Then we culture different cells that an implant would encounter. This includes macrophages, the immune cells, osteoblast, and fibroblast, which is the soft tissue cells. And we cultured different cells on these surfaces. And what we observed was that the macrophage functions was reduced. Now, the reduction in the macrophage functions means we are able to immunomodulate. Now, immune functions, if there are too much immune activity, it can result in capsule formation and ultimately rejection of the implant. But if it is too less, it can compromise the healing of the implant or integration of the implant. We need to fine tune the immunofunctions. And just by tuning the nanopore diameter, we are able to reduce the functions of the macrophages. You can see here from 40 to 80, the nanopores significantly reduce macrophage functions, whereas the functions of the good cells, which are osteoblasts and fibroblasts, were maintained. We also looked at cellular adhesion, because the way a cell behaves or interacts with the surface controls how different proteins are excreted or are synthesized at a later stage. It can control how the ultimate cell will function at a later point in time. So the macrophage spreading morphology was more inactivated in state, which represents immunomodulation, whereas the osteoblast and fibroblast were mechanically stimulated because these cells aligned parallel to the alignment of the nanopores, which is something that has never been reported before. So basically, using a simple surface, which is easy and cost effective to fabricate, you can mechanically stimulate cells. And the cells you stimulate, you get a control over it, because the macrophages activity is tuned, whereas the activity of osteoblasts and fibroblasts is enhanced. Now, just showing more details on how we can tune the immunofunctions. So the macrophages activity, the proliferation, shows that just by tuning the diameter of the nanotubes from around 50 nanometers to 70 nanometers, we can significantly reduce the activity of the macrophages. This shows that the nanopore and the cellular activity is strongly dependent on the dimensions of the nanotubes. And the image on the right is basically the live and dead assay, showing that not enough macrophages were successfully able to adhere onto the implant, and there were no dead cells. Osteoblast, the component responsible for integration at the bone tissue, osseointegration. We did not ignore the initial cell adhesion, which basically gives us clues that how the cell will behave down the line. So even at 1 hour, the different surfaces here. Now, I forgot to mention one point. The surfaces we are comparing the nanopores with, the rough and micro. So the rough is nano-rough in nature, extremely rough, and micro is more micro-machined, basically straight micro-rough lines. So these two represent clinically used surfaces. And when you look at the 1 hour adhesion of osteoblast, what you see is the cells are attaching well or anchoring well, or the cells have more extensions of stress fibers even at 1 hour for the nanoporous samples, especially for the one anodized at 80 volts, around 70 nanometers. When we look at day 3, so these are osteoblast cells, primary human osteoblast. And what you see is they align parallel to the nanopores. Now this again has never been reported before, and this has strong implications for controlling how the osseointegration or the bone and tissue integration will happen. When you mechanically stimulate cells, you basically stimulate all the cellular functions in a way. Now we talk about soft tissue integration. Osseointegration is very well established. However, one of the primary challenge of dental implant success is soft tissue integration, the integration that happens at the abutment and soft tissue level. If the seal is not formed timely and maintained long term, the bacteria has access to the bone part of the implant. So the sealing at the soft tissue and abutment level is very crucial. And we observed the timeline of cellular adhesion on different surfaces starting at 1 hour. So in the image here, you can see that the fibroblasts start to straighten and align parallel to the nanopores at 24 hours time point from day 1 onwards. And with time, at day 3, you can see the alignment has further improved and they're almost perfectly aligned with the nanopores. These are primary human gingival fibroblasts, the cells that are primarily responsible for the soft tissue sealing at the abutment and transmucosal level. We looked at day 1 of the fibroblast adhesion, and we see that the cells are really enjoying the surfaces. The cellular extensions, the filopodia, and the stress fibers are super stretched, which means the cells are mechanically stimulated. And the cells align parallel to the nanopores. Again, the reason it is important to control the mechanical stimulation of the cells or the way the cells align is because the proteins the cells will ultimately synthesize will be synthesized in the same direction. And you basically get to orient the protein synthesis here, which is really important towards ensuring soft tissue sealing. Now going at day 7, the cell make more of the filopodia, more cellular extensions, more stress fibers, which directly correlate with enhanced anchoring and enhanced integration. Now this is a strong evidence of mechanical stimulation by these tiny nanostructures, which are super mechanically stable. This is another high magnification colored image showing how the cells behave and interact with the underlying nanopores here. Next, we looked at the different gene expression of the primary human gingival fibroblast. And the genetic expression of genes like collagen type 1, collagen type 2, and VEGF and integrin beta 1 were enhanced, especially on the higher diameter of the nanopores. So we compared different diameters of the nanopores, starting from around 50, 60 to around 75 nanometers. And the effect was much more pronounced on the 75 nanometer nanopores, which is TNP80, the nanopores formed at 80 volts. And what it means is that we have the ability to enhance the wound healing, soft tissue integration, and cell-to-cell and cell-to-implant interaction by just simply modifying the surface of the implant. And it literally takes 10 minutes to modify the surface of a single dental implant. Now we come to the component where we talk about how we can load in drug and release the drug locally inside the dental microenvironment. So I stress that the nanopores are basically like empty test tubes. And in theory, you can load any drug or protein in it. You can load antibiotics to take care of infection. You can load anti-inflammatory drugs. You can load soft tissue growth factors and bone-forming proteins. And you can load any particular therapy aside of this to take care of a particular function. So the nanopores, if they're immersed in a drug solution, the drug loading happens by diffusion gradient. And once the drug-loaded implants are inserted, they will release drug slowly over time, again, depending on diffusion gradient. Just as an example, that the open pores, because the pores are not closed at top, So the release is basically quite soon. It is basically accelerated, and the entire amount can be released in around 10 days or so. However, if you do a thin coating of a polymer, if you see image here, there is a thin coating of polymer, and the polymer degrades slowly with time, releasing drug. So this is just one of the ways we have proposed here, where we can control the release of the drug from few days to few weeks. And depending upon the thickness of the polymer, you can delay the release from few days to few weeks and even months. So we get to control the different cellular functions here based on the drug that is uptaken by the cells. So in summary, the drug release, you can load any drug and protein. You can control how much the drug will be loaded and released. Firstly, based on the dimensions of the nanotubes, the wider the nanotubes, the more drug will be released quickly. Whereas the longer the nanotubes, if you get deep loading, then you can accommodate more drug, which will be released slowly. So the idea here is to achieve long-term release, because we want functions such that if you load antibiotics, the antibacterial function is continued to few weeks. Because if the antibacterial functions or the release of antibiotics is happening too quick, it can be cytotoxic to the healthy cells. Whereas it can also, if the drug is consumed so easily earlier, it can also re-trigger bacterial infection. We have also ways where we can trigger the release. For example, if you load magnetic nanoparticles in the nanopores initially, and you top it up with drugs, and if you apply a magnetic field, the drug will be forced release out. So there are different ways to even trigger the release here. And the therapeutic dosage can be designed to match what a patient needs. So the functions, the drug loading and release functions are extremely customizable to individual patient needs, because throughout our implant modification, the technique that we are using can be tailored to match individual patient needs. For instance, an osteoporotic patient might need more of bone forming protein. So in that case, we'll load bone forming protein on it. While in some cases, it might be important to ensure soft tissue sealing. In that case, we might load fibroblast growth factor 2, which assists in soft tissue sealing. So we get the liberty here to choose what we want, and we have done mathematical modeling on it. We have seen how the drugs or proteins are uptaken by the cells in 3D cellular culture models. We can also calculate and see what is the rate of spread of drug once the drug is releasing from the implant when it is inserted inside the bone matrix. So basically we can monitor, say 10 millimeter from the surface of the implant, how much drug will be released at what time. We can do the mathematical modeling of that. We've also done some animal work where we inserted modified implants with nanopores, nanotubes loaded with drug inside, say, tumor model, infection model, and some of the animal work is still ongoing. So now we come to the summary of the nanoporous implants. Now, firstly, the anodization technique can be translated to different implants, different metals and its alloys. We get great control over the topography and chemistry of it. We can control the rate of drug release depending upon what the patient will need. And we have seen that we are able to strongly mechanically stimulate and increase the activity of the cells we want. We can control which cell activity is enhanced while which cell activity is tuned. And the structures, they are super stable, and there is no chance of any toxicity by defragmentation or delamination of these nanoporous structures. The first challenge when you talk about any modification of the dental implant is the clinical translation challenges, that whether the surface modification can be extended onto the different implants, in this case, the dental implant. So if you pay attention, dental implant has a very tough geometry to optimize in terms of modification. It has sharp threads at the screw level and then curved surface all over. It is very difficult surface to manage when it comes to fabricating nanostructures, because we know it is the sharp threads are the biggest challenge where the nanopores can fracture. But more recently, we have optimized the fabrication of stable nanopores, even in difficult to manage surfaces like that of a dental implant. The electrochemical anodization can be extended to different metals and its alloys, and it is easily can be applied for different applications like cranioplasty, orthopedic implants, and stents. Selective bioactivity is basically tuning the race to invade. Now here we are not talking about drug loading and release, just having a surface which by itself manages how different cells behave. Like I told you, the macrophage activity needs to be tuned while the activity of osteoblasts and fibroblasts needs to be enhanced. So in this study, which I showed previously, we are able to show that the osteoblasts and fibroblasts, the cells responsible for integration, they are aligned and its bioactivity is enhanced, while the macrophages remain more in an inactivated state, such that we achieve immunomodulation. And obviously we can preserve the underlying Micro-Roughness. So basically you preserve the so-called gold standard in dentistry, which is the Micro-Roughness, and then you superimpose the nanostructures on top of it. If you lose the micro machining or the micro scale roughness, it can create issue with initial stability, because most nano-engineering strategies involve polishing the surface and then modification of the surface, which removes a very thin layer of the metal, and it can reduce active dimensions, which is really important towards achieving initial stability. So we can literally take a clinical implant and modify it in our lab using no more than $1,000. Enhanced healing. Soft tissue sealing is very important. So here you see the transmucosal region. So the interface between the abutment and the soft tissue is where the soft tissue healing or sealing will happen. This seal is very crucial, because if the seal is interrupted, the bacteria can gain access to the deeper parts of the implant, and it can cause dental implant failure or infection. We can control and we can enhance the activity of fibroblasts corresponding to soft tissue healing. So now that we come close to the ending of the presentation, so what is actually the fit and forget dental implant? So it is a super implant. It is a nano-engineered implant that can be fabricated via cost-effective, simple, single-step technique called anodization. And we get an implant which is tailored and customized to specific patient needs. If the patient is healthy, it will promote quicker healing. Even if the patient has compromised conditions like osteoporosis, diabetes, the release of proteins or special modification of the implant surface will make sure that we still achieve enhanced integration. We want reduced cost. We don't want any implant failure such that the patient needs to go again to get the old infected implant removed, get the site decontaminated, and get a new implant placed. That is twice the cost of a dental implant, and which can happen in up to 20% cases of heavy smokers and 5 to 10% cases of other compromised conditions. We want an implant that the dentist or the clinician fits and just forgets about it, such that the frequent care or decontamination or visits to the clinician are reduced. And so is reduced the patient discomfort. We want a dental implant which will take care of any therapeutic needs, such that if the patient needs antibacterial dosage, if the patient needs anti-inflammatory drug or bone forming protein, depending upon the situation of individual patients, the drug is not injected or the drug is not basically taken up by the patient orally and the entire body is polluted by it. The drugs that are needed will be released locally from the site of the implant. So that brings me to the end of the presentation and this webinar, and I would like to thank you for attending and showing up for this webinar. And I would like to thank Professor Sasha Ivanovsky, who is the group leader of our tissue engineering and additive manufacturing group at the School of Dentistry. The work also has contribution from Dr. Taoli, Dr. Ho Jin, and Dr. Sudesh. I am on our NHMRC Early Career Fellowship funded by the NHMRC. I would like to thank School of Dentistry and the faculty of HaBS for giving me this opportunity to present my work and for the funding support. The funding support from funding bodies like ITI and ADRF is also acknowledged, and some of the work was performed in collaboration with Griffith University at the Gold Coast. Thank you very much.
Thank you very much, Dr. Gulati. That was absolutely fascinating, and we greatly appreciate you taking the time to explain that to us. It's now an opportunity for us to ask questions. And so for those of you that are still, haven't had the opportunity to ask a question yet, we've already had a few sent through. But if you wanted to ask a question, please feel free to use the Q&A function on the Zoom surface there. The first question we have, Karan, is how does electrochemical modification affect the mechanical properties of a titanium implant, if any? And what tests have been done to confirm this?
So the bulk titanium, the mechanics of the bulk titanium will remain the same. So the surface that we modify, the nanopores, are made up of titanium dioxide. So the thin layer of titanium dioxide with nanopores is super adherent onto the titanium implant. And we have done different tests like insertion inside bone and taking it out and checking with SEM. We have done nano-indentation testing where we see the Young's modulus and hardness. And the values are really good, especially as compared to conventional nanotubes fabricated by the same method.
Great, thank you. A second question. You mentioned that the setup cost is approximately about $1,000 for these. Does that mean for someone that's getting multiple implants, the total cost is somewhere in that vicinity? Are you able to sort of explain how you think that would play out?
So the rough estimate that I gave you, $1,000, is the cost that will take care of some of the titanium that we'll need, the electrolyte cost, the power supply, which takes up most of the cost. So with that amount, you can anodize multiple implants. You can do anodization simultaneously, and that $1,000 will last you literally a long time. This is just to show that the technique is really cost effective.
We've got another one saying, great talk, Karan, thanks. Can you tell us about the possibility of timed/slow release of drugs loaded on the implants?
So whenever a drug-loaded implant is inserted inside a tissue, due to diffusion gradient, large amount of drugs is released. So initially, we call it initial burst release, which happens, say, around few hours from time of implantation. It is very important to control and manage the release of drugs, be it any drug, because a very high local concentration can negatively impact healthy cells. It can literally cause cytotoxicity. Like I explained, if you're loading antibiotics and if the antibiotics are released very quickly, that can re-trigger the bacterial infection. What you want is a slow and sustained release over weeks. Now, this can be tuned to individual patient needs.
And at this stage, we've got one last question. If anyone else has any last ones, you're very welcome to still send them through. Oh, sorry, we just have a second one as well. Can we also have sequential release of multiple drugs?
Yes, so we have shown that previously. For instance, you want to load antibacterial drug first, followed by bone-forming protein. So depending upon the loading strategy or the loading sequence, the drug will be released in that sequence. So you get control over all the parameters of it. You can even have triggered release, sequential release.
Another here. How long does it take to anodize? Does the nanotubes fracture when the implant is placed into an osteomite site slightly smaller than the implant diameter, which is the standard?
So the nanopores that I showed you in this presentation, they were anodized in 10 minutes. So it literally takes 10 minutes to anodize one or multiple implants, because you can anodize multiple implants at the same time. The nanopores are super mechanically stable. Even if the drilled hole is a little bit tinier, which is the case in clinics, the nanopores will still survive. And we have done various testing, and it is showing promising results. Obviously, we have to proceed to the further large animal models and also human trials, which will be done next year.
All right, fantastic. Well, I think that brings us to the end of our webinar today. It's been an absolutely fascinating insight into the work that you're working on there as part of Sasha Ivanovsky's team. I really want to thank you, Dr. Karan Gulati, for your time today. And I also want to thank those of you who have joined us live and also asked questions. We will be posting this recording up online shortly. You'll receive an email once it's up online, and you're very welcome to share that round with any of your colleagues or friends. Thank you once again for joining us today. And until next time, we hope you have a great day.
Thank you.